Hi, my name is Shaheenah Dawood, and I'm a medical oncologist coming to you all the way from the United Arab Emirates. We are presenting a poster entitled Early Use of a Tissue-Agnostic Minimal Residual Disease Platform that's being looked at in patients with early-stage colorectal cancers coming from the Middle East as well as Asia. So as anyone who treats colorectal cancers, we all know that it's sometimes difficult to have those parameters that can accurately identify who should and should not receive adjuvant chemotherapy. There's been a lot of effort towards trying to determine if patients have minimal residual disease post-resection of patients with stage 2 or stage 3 colorectal cancers to determine who has the worst prognostic outcome. We know that those patients who have minimal residual disease post-surgery have a poorer prognostic outcome and could be the candidates for whom we should be targeting our adjuvant chemotherapeutic protocols versus those patients who do not have minimal residual disease post-resection, where their prognostic outcome is very, very good. In this particular study, we used a tissue-agnostic minimal residual disease platform, and this particular platform looks at both mutations as well as methylations. And what was interesting about the results that we got was that only a small proportion of patients actually had both mutations as well as methylations. The rest of the patients had either methylations or mutations, suggesting that if we only detected mutations or if we only detected methylations, and not in terms of detection, but in terms of testing, we would in fact miss a bigger group of patients that are MRD positive. So it's telling us that it's important to look at both components when looking at MRD in these patients. Looks for the first time at how community oncologists are using a tissue-agnostic MRD testing platform for patients with stage 2 and stage 3 colorectal cancer. Specifically, we use the Guardant Reveal platform, which has a number of advantages. Firstly, the turnaround time is very quick, and that allows us to make those important decisions in the clinic without too much of a delay. Number 2, it tells us that is very reflective of what we've seen in those clinical trials, those prospective trials, as well as retrospective studies that have been published out there from North America, Europe, as well as Australia. And it tells us what we as community oncologists are using Guardant Reveal for in clinical practice. So it's a very, I think, important real-world data set that's reflective of what community oncologists are doing on the ground.